Hi, my name is Benjamin Singer, physician assistant at North Texas Orthopedics, and I'm here to take Dr. Donegan's patients through their total hip replacement post-op protocol. So first of all, your medications, which should be put in at your preoperative appointment, we have you pick those up before the day of surgery, and we have you do that for a couple reasons. One being it's one less thing to worry about on the day you come home from the hospital, but two, we would like you to pick up Hibiclens, which is an antibacterial soap. The night before surgery, as well as the morning of, we'd like to have you shower using this soap, wash everywhere except your face and genitalia because it's too harsh for these areas. And then after the shower the morning of, put on some clean clothes and come into the hospital. The reason we have you do this is it reduces your risk of a post-operative infection. Then to go through your medications, we'll have you on several different medications. One is a blood thinner called Xarelto, and we have you take one a day for the first 20 days after surgery. You'll start this medication the day after you get home from the hospital. Then we'll also have you on oxycodone, which is going to be your strong pain medication. You could take 1 to 2 every 4 hours for any breakthrough pain, beyond some other medications that we'll have scheduled for you. So the ones we'll have scheduled for your pain are going to be Tramadol and Tylenol. We'll have you take the Tramadol every 6 hours, and we'll have you take the Tylenol every 6 hours as well. But we'll have you stagger the two 3 hours apart. So for example, you'll take a Tramadol, 3 hours later a Tylenol, 3 hours later a Tramadol, 3 hours later a Tylenol, so on and so forth. Essentially you're taking something every 3 hours. We'll also have you taking Meloxicam, which is a strong anti-inflammatory. We'll have you taking one twice a day. And this will help with your pain, but the main reason we have you take it is it helps prevent a reaction where calcium builds up in the muscles around the hip. Lastly, we have you taking Pantene Appraisal, which is a medication to help coat your stomach. Well, if you are taking a substantial amount of the oxycodone, especially early on, we recommend you take something like Senna or Miralax, as those things can help keep you regular, as the oxycodone can get you blocked up. Next topic I want to cover is your dressing. So after surgery, you'll be giving a heavy-duty gel bandage. This is a waterproof dressing, so as long as it's intact, you can shower and you don't have to worry about covering your hip when you get in the shower. It's more water resistant than waterproof, so you can't submerge your hip, you can't take a bath, get in a pool, or get in a hot tub, but you're fine with water running over it. You should be sent home with one extra Aquacel bandage, and if the one you have on is either becoming soaked or if it's starting to peel off, you can replace that, and we recommend that you do that while you're laying down. Lastly, for your weight-bearing status, you should be provided with a walker while you're at the hospital, and we'll have you using the walker as long as you need it. For most people, that's about 2 weeks. As soon as you feel like the walker's getting in your way more than it's helping you, we have you transition to a cane for about a week and then walking on your own. But usually by that point, you'll have seen me back after 2 weeks for your first post-op appointment. Thank you, and as always, if you have any questions, please don't hesitate to call the office.